Joining us from Beirut is the head of Lebanese Medical Syndicate, Dr. Youssef Bakhash. Dr. Youssef, welcome to Q News. We're glad to have you with us to know your inputs and insights on the matter. So, with 28 healthcare workers killed in just 24 hours, how has this affected the morale and operational capacity of hospitals in Lebanon?
So currently, our healthcare sector is facing really continuous updates day by day and really harsh challenges, particularly due to the targeted airstrikes on medical teams. And we all know that now number of healthcare martyrs, including paramedics, nurses, doctors, has reached 139 with more than 150 injured people. And among them today, we have 3 doctors. Now they are on mechanical ventilation in the intensive care units. So addition to this healthcare workforces, also hospitals have become direct targets to the enemy. So far, around 12 facilities in the south, Beirut, and North Bekaa have been hit, with today 5 completely hospitals out of service due to the direct airstrikes or to the damage to essential technical systems like, for example, the provision in oxygen. The 7 remaining hospitals partially damaged are today undergoing repairs in order to maintain their services.
So continue, sir.
Yeah. So this aggression has forced us to take the decision to evacuate patients from damaged hospitals to safer ones. Hospitals in tension area, for example, in the south, in the Dahi zone of Beirut, the southern zone of Beirut, which is really a tension area and targeted zone, have been designated to handle only and to treat injured patients, and all cold cases have been postponed. So this transfer of patients has placed additional strain on the receiving hospitals, especially since they are already burdened by the displacement of, we all know, 1,200,000 people seeking care in facilities outside the danger zone.
Yes, I would like to shed light on this issue because alongside the targeting of the infrastructure, including hospitals and medical staff, we're also witnessing a mass displacement. So how is the displacement of over 1 million people, including 350,000 in shelters, impacting Lebanon's healthcare system and humanitarian response?
So now the problem is among those displaced people, and particularly those who are living in schools or dispensaries. Of course, we have counted 170,000 people. Of course, we are considering the medical problem which can arise in these communities. Particularly, we are going into the winter. We have formed with the Ministry of Health, with the NGOs, with the ICRC teams, mobile unit with nurses, with technicians, and with doctors in order to move around those centers and to see people, to treat people, and particularly to diagnose any epidemic problem which can arise between these people, which we can all imagine which burden it can create in our healthcare system. For example, if we have any influenza or if we have another COVID outbreak in those displaced people, we can imagine how much the burden will be on the really fragile healthcare system and hospitals, which is needed now today to treat the injured and the casualties more than the cold or the regular chronic diseases and people.